Heart diseases can manifest through various symptoms. When encountering the signs and complaints listed below, it is crucial to seek immediate attention from the cardiology department. Fainting due to heart diseases is typically brief, a few minutes, and sudden, involving a complete loss of consciousness. There is no response to verbal or painful stimuli. It often has a recurrent and progressive nature. Patients experiencing such episodes may require further investigation. Electrophysiological examination may be suggested for some patients. Easily getting tired can be caused by various illnesses such as anemia, vitamin deficiencies, thyroid disorders, hypertension or hypertension, and arrhythmia. Rapid fatigue can also be an early sign of heart failure, a condition among heart diseases. Particularly in the elderly, if there is known coronary heart disease or heart valve disease, quick fatigue should be considered as a significant symptom. The abnormal sensation of heartbeats in the chest area or along the chest border is palpitation. Especially when these palpitations are faster and irregular than normal, accompanied by sweating or fainting, they may indicate heart disease. Early in the management of this patient group, an EKG and rhythm Holter examination is necessary. If deemed necessary by the physician, electrophysiological examination and ablation procedure can also be performed. Chest pain due to coronary artery disease typically occurs during exertion, moments of stress, or after meals, as the workload on the heart increases. It is a constricting or crushing pain that starts from the chest bone or the left chest and may radiate to the left arm, jaw, or back. This pain, which can last for minutes, may be alleviated or relieved with sublingual medications or oral sprays. Hypertension is defined as having a blood pressure reading of 130/90 mmHg or higher, measured by a healthcare professional on at least 2 separate occasions. Before measuring blood pressure, individuals should have rested for 15-20 minutes and avoided consuming tea, cigarettes, or coffee. For individuals newly diagnosed with hypertension, it is recommended to use a blood pressure monitor Holter. Hypertension is observed in 25% of the population, and its prevalence increases with age. In individuals over 60, 60% have hypertension, and in those over 70, 66% have the condition. The frequency of hypertension is higher in individuals with excess weight. Shortness of breath related to heart issues typically initiates with physical activity and progresses in a cumulative manner. If left untreated over time, it can lead to an increase in the number of pillows needed at night and an inability to lie flat. Fluid retention in the body is associated with heart failure. Particularly the front part of the legs and the abdominal cavity are common areas where edema often occurs. In the case of pulmonary edema, the patient needs to be treated in intensive care conditions. Cyanosis is the bluish discoloration of the fingers, toes, and lips due to insufficient oxygen supply to the tissues. It may indicate congenital heart diseases, severe heart failure, valve disorders, and serious lung diseases can also cause cyanosis.